My name's Arielle Tye and I work for ProMo-Cymru. For those of you that haven't heard of us before, we're a social enterprise that works throughout Wales, and we work to ensure young people and communities are informed, engaged, connected and heard. We work collaboratively to make links between people and communities using creativity and digital technology, supporting the third and public sectors to imagine, test and create better services. So I suppose, what does that really mean? Well, a large part of my job is working with the public sector, so that can be health, that can be local government, and also working with charities and across the voluntary sector to really support people to create better, quite often digital services. And we use what's called service design, and that's a people-centered approach to designing services. And it's all about making sure that you do your research, that it's evidence-based, and actually you start designing things with people and you build them in small increments and you test things as you go along. And I'm going to be talking a bit more about this in our talk, but that's sort of what I do as a large part of my job. We run a series of talks at ProMo-Cymru called Creating Conversations. So outside of Digital Leaders Week, if you follow us on Twitter or you keep an eye on our website, we very regularly are delivering talks and training sessions, because a big part of what we do as well is trying to inform the sector and sort of keep up networks and keep you updated on the work we're doing, and also different innovations as well. So do follow us along on Twitter, etc. Okay, so into my talk then. So I'm going to be speaking today about digital youth information. And this is a massively important topic. I mean, how is it that young people get the information they need? And if they do turn to Google, which we know that they do they quickly find what they need? And if they successfully land in the right place, we've done quite a good job, do they actually understand that information, and are they able to act on it in the way that we hope that they would? We are in a really amazing age, with the internet providing so many opportunities for young people to get information directly and very, very quickly. And there are 3.5 billion Google searches every single day. However, young people struggle to find the help that they need, and they tell us this. And it's not just young people. I think we can all absolutely relate to this. So what my talk is going to be about today really is trying to address some of these questions. And the way that I'm going to do that is I'm going to share with you a project that we worked on with Public Health Wales. So we worked in partnership with them to actually really start looking at, is there a way that we can provide better sexual health information to young people? So we did an R&D project with them to look at that question. And the answers that we came up with through that process are really relevant to youth information as a whole. So that's what I'm going to be sharing with you today. So this was our question that we started with Public Health Wales, was looking at how do we make online information accessible, engaging and useful for young people? And this was in relation to sexual health. The way this project came about is we partnered with Public Health Wales to apply for an Innovate to Save grant. And that was administered through sort of Nesta Urlab and the Welsh Government. And what was really good about this is that the idea of the grant is ideas that have the potential to help improve public services, but importantly, actually be able to generate cashable savings as a result of service improvement. So this was a good project for us to get involved in, because it wasn't just about us being able to, really dig down into some of these thoughts and ideas and assumptions we had around youth information and get, more expertise in this area, but actually to really also think about how can we advocate and how can we prove that youth information is so vitally important that it can have, a dramatic impact on young people's lives if it's done in the right way. So our hypothesis really was that if we can provide information in an accessible way and prevent problems occurring early on, we will deliver both economic and social value. So this is some of the exercises that we were supported with. It's called the cost modelling exercise. So for example, if a young person contracts chlamydia, this can lead to pelvic inflammatory disease. which can lead on to infertility. And the NHS will currently offer 3 cycles of IVF at a cost of £15,000. It does also depend on your health board area, but these were the cost that we got. And that's a cost of £15,000 to the NHS. And then another example here is a very sad one about an unwanted pregnancy. This can end in abortion, which costs £394, or in some cases, this could lead on to birth and children going into care. And the cost of a child going to a care, well, obviously the costs rise exponentially. These costs don't also include costs to your mental health, housing, etc. And also really importantly, behind these figures, and it's really horrible reading out figures like this, but behind these figures, are young people. And that is obviously going through a lot of trauma in some of these circumstances. So, it isn't, as we say, just, economic value, but it's that massive social value to getting these things right. So can we make an impact? What did we do on this project? So we did a fair bit of research. As you can see there, the team and I learned so much about STIs and contraception, so many things that I didn't know before. And we also went out to loads of different groups of young people. So we went to a deaf youth club. We went to a group of young people called UCAN, and they are blind or visually impaired young people. We went to colleges and we went to schools, and we really wanted to make sure that what we designed was accessible for these different audiences, and we co-produced things with young people. So we followed, as I said earlier, this service design approach. So that was doing your R&D, going out, listening to communities, really getting down to the bottom of, how is it that young people behave when they're searching for information? Where do they go first? What do they do? Then coming up with some solutions, designing a solution, testing a solution, and that very final photo that you can see there, we actually launched and tested a new way that young people might be able to get information. And we tested a digital tool, which is actually now available for young people to use. So I'm going to talk you through this as we go on. So I'm going to go straight to the conclusions. So please do stay for the end, but I want to go straight up front with the conclusions of what we found. So this is what we came up with after doing our project. If a young person cannot find the information, then it's of no use. If a young person cannot understand the information you're providing, then it's of no use. And if a young person cannot accurately act upon the information you're providing, then it's of no use. Now, I know when I'm reading these out that these are clearly very obvious statements, but actually the majority of the time we are finding that all 3 of these are rarely actually addressed. So I'm going to go to explore them point by point. Okay, it's actually time here for a poll. Andrew, if you could maybe launch our first poll. There we go. So if you could all please answer this for me. So how confident are you that your information is easy to find? So currently. I'll just give you a little minute more, maybe a few seconds more, sorry, to answer that.
I think that's quite a few people already answering. I think we've only got a couple more. Okay, it's not quite everybody, but I think we'll end that one there so we can move on. So if we share the results, hopefully you can all see the results on your screen now.
Okay, so we've got a good variety there. So we've got some 50-50 and we've got some fairly confident. That's great, that's really positive. And we have some unconfident there as well. So thank you very much for participating in that. Okay, so if a young person cannot find the information, then it's of no use. So in this project, we started to think about, okay, what is it on that first part of the journey for young people? What do they do when they actually need help? And this works across all of our projects as well. And what we know is that young people will go to trusted adults, they'll go to friends, and they go to their networks and communities when they need support and information. And of course, they Google it as well. But one of the things they do is they tend to sort of reach out first to those trusted networks they have, and then they are very, very often turn to the internet. When we ask them, where do you go when you need to find sexual health information, or what would you do if you had an STI, the answer changed. And we found that more often than not, they were telling us that they would Google it first. And that obviously makes sense when it comes to something so personal. So some young people we spoke to said that they wouldn't speak to their friends about something like this. You know, it is a very, very personal subject to them. So what does that tell us, and why is that important? Well, it's very important because what it means when young people are searching for information is that that very first step in that chain could be a search engine. So that's interesting because that's really where the journey begins for them. So when we're thinking about designing information services and giving out information, making it easy to find is actually not just about having a website or, you know, having even your like good content, etc. It's actually about making sure that wherever that journey is, where the young person starts, that's where your journey begins with your information for them. So if they're searching into search engines, I'm worried I have chlamydia, and they live in a particular location, that's where we need to be getting them the information. So finding's not just about them searching, it's about us actively being there when they search, providing them the information at exactly and precisely the right time. And that's what's going to make it accessible in terms of them finding information. And I have got an example of this to sort of make that point. You might remember a couple of years ago, big story in the news, this schoolgirl, Molly Russell, unfortunately took her own life. And it got a really big media story because her parents started looking at her Instagram feeds, and they found that there was a lot of graphic images there of young people, well, it's not necessarily young people, but other people self-harming. And they found that all in her Instagram feed. And her father came out and they said openly, we really believe that this had an influence on our daughter's death. So that's very, very serious. What happened is at the time, and I know that big social media sites like this have been working on this since, but what happened at the time was actually because you were searching for a particular topic, the algorithms were made so that when you search for something, like if it's Christmas and I start searching for something, you know, my feed will be filled with those different things. So this also works obviously negatively as well. If you were searching for self-harm, your feed and could actually start being filled with all of these stories. So the reason that I'm bringing that up is because wouldn't it be, you know, if for us to get information out at the right time when young people need it, this would actually be influencing this sort of thing. So if a young person is going out to their social media sites and they are looking for that support, they're looking for information, they're typing in things like self-harm, well, really, we need to be providing information exactly there when they need it and providing support through those channels. This was a comment from one of the young people. Often you don't know the word for what you're worried about, so you don't even know how to look for it. So that's there. So yeah, just to sort of summarize this then, really, that young people need to be able to find the information. Otherwise, it's really going to be of no use. The internet's a really busy place, and youth information has to actually compete to be found. And that's pretty sad, but we are competing with, you know, not organizations, we're competing with, you know, all of these exciting things, massive marketing campaigns and companies, all, you know, trying to sort of sell things, trying to influence young people, etc. And so we are sort of competing to get our information out there. And we have to consider where the journey starts for a young person and get our information, where it begins. And just an example there that, you know, you might take leaflets to a local hairdresser's or a library, and really it's the same principle, you know, thinking about, okay, where are they going to be? And that's where we need to be as well. So finding information can be very complex. Okay, so moving on to the second point, which is if a young person cannot understand the information, then it's of no use. Now, I would argue that this is one of the easiest to tackle. Unfortunately, though, it's often executed poorly. But I think there's a lot of information out there about how we can actually make information accessible and easy to understand. But I'm going to go to the second poll, firstly, to ask you that question. How accessible you feel that your information is? There we go. So how confident are you that your information is accessible? So very confident, fairly confident, 50-50, fairly unconfident, or very unconfident. I feel like a quiz host when I read this out.
We're just waiting on a couple more people, so we'll give them another 10 seconds or so. see if anyone else can answer it. I'm afraid if it hasn't popped up for you, I am sorry. Perhaps if you're viewing on another device, it might be that perhaps these haven't popped up for you, but I think we'll have to end it there.
Okay, so 40% saying fairly unconfident, but we do have some mixed things. But thank you for sharing that. So again, yeah, I mean, that's what we hear across the board. You know, is our information really that accessible? So thank you for that, Andrew. Yeah, so to make information, you know, easy to understand, I'm not going to labor this point too much because really it's about following accessibility guidelines. There is so much information on this, presenting information in a youth-friendly or just person-friendly way and keeping it super simple. Testing with your target group to see if they understand the language and key messages. And also I've put in their video because video is a very, very accessible format if you do this well. But there are a couple of things that I wanted to share from this particular project that we found that were very interesting. And this comment here from a young person in Cardiff saying that we don't need something to be fun. We need it to say what it does on the tin. And I think that's a really good comment to think about when we're designing youth information for young people. And this I found extremely interesting. So as I said, we were working with a group of young people from UCAN, and they were made, this group is a theatre group, and they're made up of young people who are either blind or visually impaired. And we were speaking to them and we were thinking, right, we need to develop a solution that works for you. And it was a bit of a challenge. And I was worried when I first went to the group and thought, how are we going to make sure that this is actually accessible for you to be able to use? And they told us that actually they found video very, very accessible as a format, for example, and actually just really like, I suppose, I suddenly felt so uneducated about the fact that, of course, now with all of these different, screen readers and things like this available to young people, they are actually able to use technology to be able to make, see information online very accessibly. So moving on to my third point, if a young person cannot accurately act upon the information, then it's of no use. Okay, so for this one, I have to say that this was one of the biggest insights for me when I was doing this project. So the first two were more like, yeah, I do understand about making sure that your information is easy to find, and I do understand about making information accessible. But this one was particularly interesting. So what we did as part of our project, and it's a really important part of the service design approach, is to try and observe how your users would behave in a given situation. And that's difficult because often in consultations, we ask people how they would behave, but what people say they do and what they actually do can be two different things. So it's trying to think of, okay, so how can you set up some tests to see if you can observe how your audience are going to behave in any sort of given situation. So what we did is we went to Stanwell Sixth Form. We were very pleased that they let us come and work with a group of their sixth formers. I know that some of you are joining this call from other parts of Wales and also from England and across the UK today. So just to tell you a tiny bit about Stanwell. So that is a school that is based on the outskirts. It's in Penarth, and it's a very sort of affluent area. It's a very, very good school, and they've got high achieving young people at that school. Just to tell you a little bit of background on these young people that we work with. So what we did was we set up a storyboard and we gave them a scenario. And I went in on a Monday morning and I said to them, right, this has happened. So your friend slept with Sam on Saturday night. And they come in and they tell you that it was unprotected. But you know that Sam is actually a total player. And now, actually, you guys are having this chat and you're worried that you may have got chlamydia because it's rumours going around the school that actually Sam has got chlamydia. There's a big rumour going around. So what are your next steps that you must take? So we gave them this scenario and it was so interesting, the results they did. So we asked them to write this in a storyboard right now, every single step you're going to take. So of course they got their phones out, they chatted and they started searching online. Now, most of these young people, I think all of them, they found the NHS website, they found their local drop-in clinic, they found the times for their local drop-in clinic, and they did very, very well. And I was thinking, right, they found out all of this information. And one of the young people, they found the NHS website and they looked at the information on chlamydia. And they read out to me, they said, oh, it says here that the symptoms won't develop in your body for 14 days. So that's a significant line. So they said to me, the symptoms won't develop in your body for 14 days. And I was thinking, okay, they've done really well at finding this correct information here. But then when we asked them the very final box, which was when will you actually go to that clinic? And bearing in mind, this was like a Monday, and they all said they were going to go to the clinic at the next possible available appointment. And that was going to be on the Wednesday, because that's when the clinic opens. So that was 2 days or 3 days after they've had this sexual encounter. And actually, to say every single young person took the incorrect action. That wasn't when you should go to the clinic. The idea is that actually you need to wait for 14 days. And this is what the information was saying on the website. If you turn up to the clinic before that, it's a wasted visit and you may get turned away. This will have also an impact on waiting times. And more importantly, you might not end up coming back. So the crucial part of this information on the website was that you needed to wait for 14 days, but not one of those young people actually took that correct action. And that is so interesting to us. And this really took us on this journey, and we thought, right, can we do something about that? What we know from working with Public Health Wales, the team there was sort of telling us that actually there's an awful lot of people in these queues, which are called, like they said that they're worried, they're sort of worried, but they're actually well. So they said worried well people waiting in the queues, and actually they don't need to be seen. But that means that there might be people that don't get appointments that really do need to be seen. So this was something that we thought we really wanted to tackle. So what we did is we designed a tool. It's very simple, using like a logic survey to see if actually we can get them to the exact information they need without providing them with anything else, without providing them with any possible option, but to select the correct option. And I'm just going to see now if I can run you through this tool. Okay, so you can find this on the Frisky Wales website. So this is a website for young people to access sort of sexual health information in Wales. And this is called Assess Your Risk. So this is the tool that we came up with and tested. So what you do is you go on and you press start there, and I'll talk you through it. So are you looking for information on? So I'm going to say sexually transmitted infections. Which of the following applies to you and the type of sex? So I'm a woman who has sex with men. And how old are you? I'm going to go for 21. Did you use a condom during sex? No, unfortunately, in that scenario, I didn't. Did your sexual partner or anyone else advise that they might have an STI? And I'm going to say yes for that, because in this scenario, that's what we're worried about. Did your sexual partner advise you they might have HIV? No. Click here to see the results. We recommend you visit your local sexual health clinic. Please allow 2 weeks to have passed since you had sex before you get tested. Otherwise, you'll be turned away from the clinic, as tests will be unable to detect an infection, and avoid having sex until you get that. And obviously you can click there to get your local clinic, etc. So I'm going to go back into my presentation. I'm just trying to make this big again. Andrew, how do I make this big again?
Oh, that should be the little square. So see next to the cog, if you press the little square next to the cog, that should do the job.
I can't see it.
Oh, sorry, if you move your mouse, there you go. Can you see the little cog next to you on the left?
Oh, I tell you
left
what,
again.
I think it's because that's up above it. Oh, there we go, look. That's it.
That should do it.
Thank you very much. It's good to have tech support on call. So we're getting to the end of the presentation anyway, but as you can see, and in fact, I will say like about that tool, that there was a couple of extra additions. So this is a prototype, this was something to see, does this actually give us a little bit more, are we getting more young people to get to the right information? And when we tested out this tool, absolutely yes, more young people, when they followed our scenario and used the tool, were able to get to the accurate and correct information. And the thing is, with having a prototype, the idea is then we can build on that. So that is very simple, but it's effective. And what the young people told us, and the clear additions to that would be then you immediately could book into a clinic. So the idea is that when you get to that, it doesn't even have to tell you to wait 14 days. It could just give you a diary where you click into a clinic, and then it sends you a text message to remind you, and then it sends you a Google map so that you turn up at the clinic. And this is sort of, you know, the future of how something this could work. And actually, this is really how other things work for us. You know, you imagine that, you know, a Google map would come up on your phone and you'd actually be able to find the way you were going. And actually, another really interesting thing on that the young people said they really felt they needed was that in these situations, they start feeling very, very anxious. And they would really like to see like videos on things like what happens if I do have chlamydia, or what actually happens at the clinic. So we did do a video a while back on literally the journey of walking into a sexual health clinic, what you do when you get to the desk, what happens when you go into the different rooms. And so young people really like to have this sort of upfront info. So the idea of this tool is not only would we use it to get them to what they needed, but then actually have these add-on things like extra videos, text messages, being able to link directly into clinic to book an appointment, and these sorts of things to make it much easier for young people to get the information. So to conclude the talk, and we will go into a Q&A, but these are those three really important points. So if a young person cannot find the information, then it's of no use. So you really need to be making sure that your information is where young people need it and following their journeys. You know, unless you know, you've got a massive sort of marketing campaign. There are some services that young people will remember immediately the name of. I know NHS, for example. A lot of young people know Samaritans. A lot of young people know Childline. But it's very, very hard for young people to immediately sort of come up with, to remember and recall the exact service. But what they might be doing is going online and searching. So that's something to think about there. If a young person cannot understand the information, then it's of no use. Making sure that, you know, it's absolutely accessible. And then finally there, if a young person cannot act upon the information, then it's of no use. So making sure that, I suppose, you've trialed and tested this with young people. Are they actually, you know, taking the right action after reading your information? But that has come to the end of my talk. So I want to go over now to a Q&A. So I'm going to stop sharing, and my colleague Andrew is going to join me. So please, if you've got any questions, yeah, please do put them in the chat, in the chat section.
Yeah, thanks, Arielle. That was really great. I really enjoyed that. Just while we are waiting, in case people have got questions to come up, just sort of looking at some of the notes I was making really throughout that. So do you think that having the form that kind of gives you almost like a personalized response, do you think that was more effective than just having a website that in theory said the same thing?
It was effective, yes. We didn't make that clear. So we redid the test, and we had significantly higher results from using the form, because there was really no sort of other, you know, because you go through it and it's logical. There isn't really, you know, another way that you could interpret that information when it's presented to you.
Yeah, I think it's, I mean, obviously for people that aren't familiar with the schools, it's really interesting because Stanwell is such a high achieving school. It's one of the most successful schools in South Wales. And, you know, to sort of have them, it's amazing is that they read the information and yet didn't take any of it in. And I think it does sort of show, you know, this idea of almost like our actual behavior versus our kind of perceived behavior. You expect that they would have gained that information. I suppose it's really interesting and a little bit worrying, to be honest, that they even young people as bright and high achieving as them weren't able to get what they needed from it. So I think it's really interesting. I can see one question, which is, are there any plans to develop further pilots or develop on the pilots?
Yeah, we are hoping to. We've formed this really great partnership now with Public Health Wales, and we're hoping to develop this further because, you know, with any of these things, it's about building something small, and that's what we did. And then it's about developing it and continually developing it and adding to it with those suggestions that we said. But it's, you know, like any of these set situations, it's due to being able to sort of secure some future funding to do that. But we are still in, you know, we work very closely still with the team in Public Health Wales, and we're hoping, you know, that we will they'll be able to develop this in the future, but that relies on getting the resources to do that.
Sorry, something else that I know we have got another question as well, which I'll bring up in a second, but something that you were mentioning earlier was the Google search, and the fact that obviously with something that so, I don't want to say embarrassing, but the honest truth is that we probably all would feel a little bit embarrassed if this was something we had to find information about. And I had to review as part of this project some of the search terms that were coming in. And I wish I'd counted them, but I think we must have seen about 24, 25 different ways that the word chlamydia was spelt in search. And it's amazing, again, that kind of level of insight that you think, how do people find this information when, a little bit like you said, they don't sometimes even know the word they're looking for, let alone how to sometimes spell it. And yeah, I think that's something that we probably really need to be aware of if we're going to make sure that our results are coming ahead of the wrong organizations and the wrong websites. So I'll just go back to the question. We had two more. So the first is, how do I know where is the starting point to reach young people? So how do I know where is the starting point?
Yeah, so this is a great question, and I should have covered that a bit more as well. And in fact, if you come along on Friday, we're going to be doing a bit about sort of user research. So it's about thinking about your users, always starting with the perspective of your service user. So what we did was we did a number of user journeys. So you can do that with young people. That's great, isn't it? Like that exercise that I did where you looked at their behavior, you know, what's the first thing they do when they're presented with a scenario? You can also find those sorts of stats, like Andrew was saying there, that we were able to really look and dig into what young people were actually searching for online. But really, another thing you can do is just, you just do a map and you just say, right, I need help. So that's your first point, is I need help with something. What do I do next? And that might be different. So you do a number of users. So for me, that could be, I speak to my mum because I have a really good relationship with her. But then what's next, isn't it? Do I then Google? Does my mum need to, you know, maybe look for something? How does she have the information? So actually you can do a number of different user journeys so that when you then develop your solution, you can see and make sure you walk your users through your solution and does it work for them? But there is loads more information on that. Have a look at user journeys, so do a search on that, or, you know, like I said, attend our hack on Friday.
So I'm just replying to a very, very nice comment from Emma Malloy from Buckinghamshire Council, who said this is the most helpful webinar I've attended. And honestly, we don't know Emma, just to be completely honest about that. We don't know her, we haven't paid her. That's really, really kind. Thanks, Emma. But she needs to share this with her colleagues, so the recording will be massively useful. It was just a chance for me to say that, yeah, the recording will probably be going out around midday tomorrow. It will be on our Twitter account, which is obviously just at ProMo-Cymru. I think that should be, in fact, I can maybe put a link to that in the chat in a moment. It'll be kind of on YouTube, but probably the best place to find it would be via our Twitter account. I haven't seen any other questions coming in, so I don't know if now might be a good time to talk a little bit about the Notion page.
Yeah, that's good. And also just to say there to Emma, if you do want to get in touch with me at all, I'm very happy to, in fact, I'm happy to share my email address now to everybody. So I'm going to send that around. So if you know, for example, want to ask me anything after this, or you're interested in any, you know, our services, the work we do, I'm just going to send that around to everybody as well. So you're very welcome to get in touch with me. Great, yeah. And so talking about our Notion, so we have we put together a resources site full of loads of different resources to support you with sort of digital working and lots of other things, but mainly sort of focused around digital working. Andrew, have you got a link there to be able to send around?
Yeah, I've actually just popped that in the chat, but I can share my screen if you'd like to. We can just sort of talk people through it very, very quickly. So yeah, this is something that we as a team set up right at the start of lockdown. And the initial idea was really just to have one central place where we could share useful digital skills, tools, resources, links, PDFs, literally anything that we thought would be of some use to the third sector in Wales, but really and beyond. So I've sent the link to you. There's lots of different things in here. We've kind of tried to break it down into different sections, whether you work with young people or charities. Yeah, there's loads and loads of different stuff in there, but I'd really recommend, if you are interested in any of this stuff, it's definitely worth having a look. I mean, we can't take credit for the content because a lot of it's been written by some other fantastic organizations. We've just tried to kind of put it all in one place for the third sector there, really.
We've got something from Cindy. saying the problem with using social media to reach young people is the platforms are already crowded. I'm finding it hard for my messages to be seen by young people. Are there any tips? Andrew, you've got to talk on that.
Oh, look, perfectly. Yes. So yeah, you're right. The problem with using social media, it's a very difficult way to stand out. Of course it is. But at the same time, we know we have to be there, and we just have to do it to the best of our abilities, because it's not really enough just to sort of say it's hard. So yeah, that's actually a big part of my talk tomorrow. I'll be talking about young people's digital trends. So again, I'll pop a link to that in there. So that is at 3:30 tomorrow. So again, you can sign up via the Digital Leaders website. But yeah, we'll be looking at kind of some of the ways that we can hopefully stand out through social media. And actually looking in particular at my favorite thing in the world at the moment, which is just TikTok and short form video. But I don't want to give any of the spoilers.
Okay, that's great. So we've just had a comment in here saying, I saw the project advertised on my local pharmacy and was able to pass information on to a young person that I knew had been worrying about STDs. They were particularly relieved not to have to go to a clinic as there was a home testing kit. Yeah, so now in Wales, and this is really interesting actually. So, as part of this sort of innovative new way to provide, sexual health services to young people, they can now test and post. So they can actually do a test kit at home. We weren't actually involved in the development of the test and post service. However, we've been working closely with it, because the idea is that this tool would then link directly for you to be able to order a kit as well. So it's trying to join up all these things together. And actually, sometimes a lot of it is around those full pathways, isn't it? So right from that beginning of the journey right through to the end. And sometimes you don't have control over every part of that pathway, because actually, like, we don't know that the clinics have a booking system yet. So how do you link with their booking system? How do you link with all these things? But for something to be really effective, it's about that partnership working across the whole journey. So that's just really, really great there to say that, yeah, young people can now get a test at home testing kit, which obviously makes it, it relieves a lot of anxiety for young people. Thanks for sharing that.
Great. Well, unless there's anything else that comes up in the next couple of seconds, I think it's probably best for us to bring that to a close. Yeah, thank you to everybody for joining us again for our second webinar in this series. As I said, we've got another one for tomorrow, which is myself at 3:30 talking about youth trends. Then we have Marco's, which is rethinking youth work, on Thursday, again at 3:30. And yeah, the one with Cast and Arielle on Friday morning at 10 a.m. Yep, I think that's all we've got left to say. So thank you, Arielle. Thanks very much, everybody, and hopefully we'll speak to you again soon.
Yeah, thank you, everyone. Diolch yn fawr.